Welcome back, and we're continuing the news. And in this evening's edition of the Health Report, Shamala Pullen looks at a rare kidney cancer in children.
Wilms tumor is a rare form of kidney cancer that mainly affects children. It is also called nephroblastoma and is the most common kidney cancer in children. The condition usually occurs in children between the ages of 3 and 4. It is much less common after age 5, but older children and adults can also develop it. The tumor most often affects only one kidney, but in some cases, it can occur in both kidneys at the same time.
We have seen some associations. For example, families who would have had a history of cancer, family history of cancer, then there may be an associated gene that predisposes the child to that particular condition. But otherwise, there isn't, say, a particular cause during pregnancy or after the child is born that we can identify to say, this is cause and the cancer is the effect.
The symptoms of Wilms tumor can vary widely. Some children may not show any symptoms at all, while in rare cases, others may experience pain.
Many times being detected by the parent. Maybe when the parent is bathing the child or holding the child, the mom or the dad would notice that there's an abnormal swelling in that area. So that's one of the main concerns. On a few occasions, we actually have the child who would have detected this mass or this lump and has brought it to the attention of the parents, which then get brought to the attention of the doctors. Other symptoms include passing blood in the urine, and this is a serious sign. So any child, boy or girl, where there is blood being passed in the urine, whether at the beginning, totally, or at the end, that should be seen as a serious symptom. Another symptom that we may see, which is rare, is pain. The child may complain of discomfort in the abdomen or in that general area. So that is another symptom. And coupled with the mass, then that must be taken serious.
Wilms tumor cannot be prevented, but like most cancers, early detection can improve outcomes.
For stage 1 cancers, it is possible to cure children with surgery alone even. A matter of fact, this is one of the success stories for children and cancer treatment overall, where we are able to cure children with surgery as well as chemotherapy and radiotherapy where appropriate. So the earlier the condition is detected, the better it is for the child.
If it's in the late stage?
If it is in the late stage, there's still chances of cure. The prognosis is still good. However, we are talking about somewhere in the 60% region, as opposed to 90% to 100% for stage 1.
With your health report, I'm Shamala Pullen wishing you good health.